Hello, so today we will be going over lasers. This is a lasers presentation by Jasmine Villegas, RDH. So today we'll be talking about the proper and safe use of lasers in dental hygiene. So we're going to start off with the question. So what is the most common risk associated with improper laser use in dentistry? I'll give you a second to think about it and kind of collect your answer. But the answer is eye injury. Eye injury is the most common risk associated with improper laser use in dentistry. So some of the learning objectives that we will get through today is upon the completion of the course of the proper and safe use of lasers in dental hygiene practice, the students will have described the basic principles of laser physics, including wavelength, power settings, and tissue interaction as they relate to dental hygiene procedures. You will be able to identify the different types of dental lasers used in dental hygiene practice and explain their approved indications and limitations according to the current professional guidelines. You will be able to apply established laser safety protocols, including the use of personal protective equipment, operatory preparation, and hazard controls to ensure patient and provider safety. Demonstrate proper laser setup, activation, and shutdown procedures following manufacturer instructions and clinical standards. You will be able to analyze patient case scenarios to determine appropriate laser use based on medical history, periodontal status, and procedural goals. Evaluated laser-assisted dental hygiene procedures for effectiveness and safety by identifying potential errors, contraindications, and areas of improvement. So let's start with what is a dental laser? A dental laser is a device that produces a concentrated beam of light energy used to remove, shape, or treat oral tissues. In dental hygiene practice, lasers are most commonly used for soft tissue procedures such as bacterial reduction, sulcular debridement, and gingival therapy. So what does laser stand for? Laser stands for light amplification by stimulated emission of radiation. So we're going to break that down. Light, it produces energy in the form of light. Amplification, the light energy is intensified. Stimulated emission means the energy is released when atoms are stimulated. And then radiation, the energy travels in waves. So the laser is monochromatic, one specific wavelength, one color of light. Coherent, all light waves move in the same direction. Collimated, the beam is highly focused and does not spread out much. These properties allow the laser to precisely target tissues with minimal damage to surrounding areas. So how do lasers work? So they emit the light at a specific wavelength. Energy interacts with the tissue through absorption, which is the desired effect, reflection, transmission, and scattering. Absorption produces cutting, coagulation, and bacterial reduction. So some wavelength basics. Wavelength is measured in nanometers. It determines how lasers interact with the tissue. So different tissues absorb to different wavelengths. So proper wavelength selection is equal to safety and effectiveness when you're picking the wavelength. So different tissues absorb at different wavelengths. So water absorbs at a certain wavelength, hemoglobin absorbs others, and melanin absorbs others. That's why different types of lasers are used for different types of procedures. For example, a diode laser at 810 to 980 nanometers target pigmented tissues. And then others are highly absorbed by water and can be used on hard tissue. So understanding wavelength is critical for choosing the correct laser, setting proper levels, preventing thermal damage, maintaining patient safety. Types of lasers in dental hygiene. So a diode laser is the most common in dental hygiene practice. Wavelength range from 810 to 980 nanometers. It's highly absorbed by hemoglobin and melanin. It is primarily used for soft tissue procedures, compact and cost-effective compared to other laser systems. So soft tissue applications are gingival contouring, sulcular debridement, bacterial reduction, hemostasis during periodontal therapy. This is a Gemini diode laser. This is the one I use at work. So indications for use of a laser. Dental lasers may be indicated for bacterial reduction during periodontal therapy, gingivectomies for tissue overgrowth and inflammation, adjunct to SRP, sulcular debridement to disrupt biofilm, and minor soft tissue lesions. Within scope, I know gingivectomy, so everything within scope, different states require different things, and you're allowed to do different things in different states. So overall, though, the clinical goal is to enhance healing, reduce microbial load, and improve patient comfort. So we're just going to go over a video that kind of explains just that. Sorry about the commercial here.
Before or after buildup or gum disease is removed, non-cutting laser technology is used below the gum line to kill harmful bacteria and reduce the chance of the spread and progression of gum disease. Laser technology will help with healing and reduce pain during and after the procedure.
Okay. So proper laser setup, we will watch a video over this, but I'm just going to kind of read over the steps. So proper laser setup, review the manufacturer instructions, inspect the unit, cords, and fiber tip, post laser warning sign, ensure wavelength specific eyewear for everyone, set correct power and mode for the procedure. So before activation, confirm patient assessment indication that this patient does need laser. Remove reflective instruments. Initiate fiber tip if required. Use high volume evacuation at all times. Announce a laser on before use. So during use, maintain continuous motion. Monitor tissue response. Follow recommended power settings. Communicate with the patient. Use fume evacuation at all times. So proper shutdown is returned to the standby mode. Turn key off and removed. Dispose of single-use tips, clean and disinfect per infection control and protocol, and store lasers safely. So we're going to watch a video. It's about 3 minutes long.
On the unit, you will see the warning sticker to not spray liquids or cleaners on the display. You may want to keep the sticker as a reminder to your office. You can also download a PDF version of cleaning instructions from the Gemini Evo dashboard. The Gemini Evo starts up by pressing the power button. It is designed with a transparent electroluminescent display that can provide high-resolution viewing angles from up to 160 degrees of field of view. You will see the top bar fill as it starts up. You will have to enter the passcode found in the instructions to unlock it. The unit then prompts you to choose your wavelength. There are 3 wavelengths available: 810 nanometers, 980 nanometers, and dual wavelength mode combining both. After selecting your wavelength, you can input the average watt setting to start cutting if you know the settings you need to use. Select Active, then depress the foot pedal. The Gemini Evo comes with presets organized into 3 intuitive categories: non-surgical, surgical, and pain relief or PBM. All power settings can be customized on the Gemini Evo laser unit or via the dashboard. The pain relief or PBM presets correspond to the included 3mm, 7mm, or 25mm adapter tip. The display will show time in seconds and can be adjusted with the right arrow by tapping for 1-second increments and holding for 10-second increments. The timer counts down in seconds and stops automatically after treatment time is completed. If the activation pedal is released mid-treatment, the timer will pause and will resume when the pedal is depressed again. The unit is designed with Guided Touch Interface, or GTI. As you operate the Gemini Evo, only relevant icons light up to help guide you through the interface and make proper input selections. Pressing the menu button brings up the options for haptic sense, aiming light, tip illumination, and sound settings. The Gemini Evo foot pedal is equipped with haptic sense. As you press the pedal, you will feel a buzzing sensation to the foot while the activation pedal is depressed. The handpiece is also equipped with haptic feedback in the PBM mode to provide the patient with the same sensation to let them know when the treatment cycle has started and ended. To adjust intensities between low, medium, high, and off, touch the arrows up and down. An aiming light is also built in to aid you in visibility during treatment. You can adjust its intensity as well as deactivate it. The Gemini Evo handpiece is equipped with a tip illumination light to provide better visibility of the surgical site during treatment. Its intensity can also be adjusted between low, medium, high, and off. Many of the options and settings of your Gemini Evo are customizable through the unit or the dashboard. This concludes the Gemini laser walkthrough. Be sure to watch our other Gemini Evo videos, unboxing, and dashboard tour for more information.
Okay, so we have another video of we're using a laser.
So I wanted to go over a few more tips with you when using your Gemini. It is very different than using your ElectroSurge. With your ElectroSurge, it is side and end cutting. Soft tissue lasers are more end cutting. With the laser, if I try to go on the side, I'm not going to cut. I can actually bevel tissues, but it's not great for cutting. You do want to hold it more perpendicular. And if I try to move it too fast or press down too hard into the tissues, then I'm more ripping through tissues rather than allowing the laser energy to do the work. So the proper technique would be touch the tissue, press your foot pedal, and allow that laser energy to heat those molecules up to the 100 degrees Celsius. It's a very light feather touch stroke. Let the laser energy do the work for you. So remember that you want to use as little power as possible to achieve the optimal results. If you're using a very high power setting and you see charring, blackened tissues, that means that you have too much power and you're going to cause thermal damage, which will lead to more postoperative pain and swelling. At this point, you need to turn your power setting down on your Gemini, or you need to speed the paint stroke a little bit faster. The optimal result is to have as little charring as possible so that your patients have less postoperative pain and swelling. Healing time.
And that video is just to kind of show you how to use it. Obviously, you're not going that deep. You're not cutting tissue because that's not what we do. So we're just going around the gum. Just wanted you to see that motion. So contraindications for laser therapy. Laser therapy should not be used when a clinician lacks proper training or certification. Patient is taking photosensitive medications. Protective eyewear is unavailable. Reflective instrument surfaces cannot be controlled. There is uncertainty about diagnosis or lesion type. Improper use may result in thermal tissue damage, delayed healing, retinal injury, and legal liability. One medical consideration you should take into consideration when you're using a laser is uncontrolled systemic conditions. Patients with seizure disorders triggered by light, and caution with pacemakers, so just verify with the manufacturer. So some laser safety protocols. So PPE, mask, gloves, protective eyewear, wavelength-specific laser safety glasses, protective eyewear for patients and all staff that are in the room, operatory controls, post-laser warning signage, limit room access during activation, remove reflective instruments, and use a high-volume evacuation HVE to reduce fume. Before activation, verify settings, confirm correct wavelength, test fire per manufacturer guidelines. Some OSHA and legal considerations are standard precautions, follow infection control guidelines, manage laser fume as biohazard, and documentation is very important. So you're going to document type of laser and wavelength, power settings and duration, tissue response, informed consent, and post-op instructions. So we're going to start with the classroom activity. This first one, you're going to work in small groups of 3 to 4 students. You're going to read the patient case scenario below. You're going to discuss these questions provided and decide on your group's answers. Be prepared to share your responses with the class. So I'll give you a few minutes to kind of come up with the answers. Here is the case scenario. So a patient is a 55-year-old patient, presents for periodontal maintenance. Clinical findings include generalized 4 to 6 millimeter pockets, moderate bleeding on probing, controlled hypertension, no known drug allergies, no photosensitive medications, and reports mild discomfort during scaling procedures. So the discussion questions are, is laser therapy appropriate for this patient? Why or why not? What safety protocols must be implemented before beginning the procedure? What laser settings or considerations would you evaluate before treatment? Are there any contraindications present in this case? What documentation is required after completing the procedure? So take a few minutes and then we'll discuss these questions together. Okay, so laser therapy may be appropriate if no contraindications exist. And as we see, there is no contraindications. Patient has controlled hypertension, no photosensitive medications, no known drug allergies. So safety protocols include PPE for clinician and patient, laser eyewear, proper signage, and operatory preparation. And before you use it, you check the laser settings based on the tissue type and procedure. And documentation. Document type of laser, wavelength, settings, power and procedure duration, tissue response, patient tolerance, and informed consent, and post-op instructions. Now for the second activity, we're going to go over a 5-question quiz that is going to review this PowerPoint. So what does laser stand for? What is the most common injury associated with improper laser use? Name 2 safety protocols required during laser use. Which type of laser is most commonly used in dental hygiene? What must be documented after a laser procedure? So take a look at those questions and we will go over the answers together. So laser stands for light, amplification, stimulated emission, and radiation. And we went over this at the very beginning. What is the most common injury associated with improper laser use is eye injury. 2 safety protocols required during laser use, eyewear and signage outside the door. Which type of laser is most commonly used in dental hygiene is a diode laser. And what must be documented after a laser procedure? You're going to document the type of laser, the wavelength, settings, power, procedure duration, tissue response, patient tolerance, informed consent, and post-op instructions. So just a little overview about everything we talked about today. And here are my references. I hope this was helpful.